A free speech case involving a pair of I Heart Boobies rubber bracelets and a middle school principal may be headed to the U.S. Supreme Court. Tuesday, the school board of Easton, Pennsylvania voted to challenge a federal court's decision that the bracelets are not disruptive. The attorney for the school district says he thinks the case is really about who should be able to decide what is or what is not lewd or improper expression in the context of a public school. And healthcare professionals now say eating healthy can help breast cancer survivors fight a recurrence of the disease, so much so that certain hospitals have even started offering seminars to teach patients what kinds of food they should eat to boost their immunity. Arise News medical contributor Dr. Aletha Maybank is here with us to talk about this and other health news. Hey, Dr. Maybank.
Hello.
Good to see you.
Good evening. Good to see you.
You know, this seems to be sort of if you will, common sense, because eating healthier is just better for you in general. But what do we know about how it specifically can help breast cancer survivors?
Sure, and I completely agree with you. I think what's happening now is there's so much more evidence coming forward to actually show the real benefits of healthy foods. And so for breast cancer, we actually know for all cancers, about a third of the cancers, their cause and their reason for them are really poor diet and lack of physical activity. And more and more information is coming out about this. U.S. women, 1 in 8, are likely to get breast cancer. And so if we can help women prevent it by what they eat, prevent reoccurrence, prevent progression of the cells, that's what also these vegetables and eating healthy is supposed to do, we can actually cover a lot of ground. So the areas and what we know or what work and what the studies have shown are, one, the carotenoids. So those are your orange and yellow vegetables. The cruciferous that I just learned, a big term for broccoli and cauliflower, also very important. Your omega-3 fatty acids, which are found in fish, and fresh fish, not necessarily fish oils, but salmon and cod and haddock, very important. Also help out with heart disease as well. Then you have your whole grains, very important. And then the one area in which there's somewhat level of controversy is soy. Soy, there are some studies, a lot of nutritionists feel that it's actually very good and very beneficial against preventing breast cancer. A lot of medical doctors and American Cancer Society specifically has not come out completely to say to take soy, because soy actually contains and produces estrogen in the body, which is also known to stimulate cancer cells. So there's still a lot of conversation, evidence that still needs to be built around that particular area to see if we really want to promote soy. And then the other one that we talk about, our first foods for babies, is breastfeeding. Studies, plenty of evidence now out showing that breastfeeding actually decreases the incidence of breast cancer. Wow, just another benefit for breastfeeding for those who can't do it. It's important to note that eating healthy, eating these foods can't prevent breast cancer. And that's a very good point. It potentially decreases your risk. The bottom line is, even if you eat healthy, you eat the best vegetables, you exercise as much as you can, there's still a risk of you getting breast cancer. There's still a risk of you getting any particular cancer. However, we do know it's very helpful when you do take these habits on. All right, I wanted to point out that. And is there something particular about these foods that have these, if you will, cancer-fighting properties? Yeah, I mean, each one has a different property, and each one does a different thing. So it's very specifically targeted to whatever, we're looking at. And we know, again, omega fatty acids has a lot to do with how it protects your blood vessels and how it protects you from getting heart disease, as well as all these other processes in cell formation and inflammation and decreasing that. So there are many different mechanisms in which these particular foods work. And I'm guessing this really is about changing all your eating habits, not just eating more broccoli while you're eating Cheetos or whatever the case might be. Right, and a great point. Exactly. You need it's a lifestyle change that we say, and it's a commitment to taking part in eating healthy foods every single day. And the other piece of it is also just watching the amount that we eat, because I have seen people even eat well healthy foods and they still pack their plate on. And the bottom line is we have to still control our weight, because also weight gain also increases your risk of breast cancer, because fat cells secrete estrogen again, which also stimulates breast cancer cells. Yeah, good point. Point well taken. While we're talking about breast cancer, and of course we're coming to the end of October, which is Breast Cancer Awareness Month, and that is this test that can detect a number of types of cancer. Tell us about that. Right. So this is out of the UK. The United States hasn't quite gotten to this, or it hasn't been public yet in the United States. And so right now there are mainly two things that we test for breast cancer that are particularly on the cells or the tumor itself. And there are two proteins. They're an estrogen receptor protein as well as a HER2 protein, which I've mentioned before in previous segments. So now what this study has done is it's looked at over 1,000 different tumors. And basically, as noticed that 93% of them will fall into, or the proteins on the tumor will fall into about 7 different classes, which is pretty phenomenal. And 2 of those classes are the ER receptor that I mentioned before and the HER2 receptor. So now, if we have a sense of what are the 7 main proteins that are on the outside of these tumors, then we can actually target treatment towards them. And so this is a tremendous step in the field of breast cancer research, but also they understand that there's still some work to be done. This is right now mainly in the UK. It has not come to the US, or it hasn't been broadcast yet in the US, but definitely a tremendous sign. It just offers the opportunity to have individualized treatment for a particular type of breast cancer that a woman may have.
Yeah, it'd be interesting to monitor that, because that could be very exciting.
Absolutely, it's very promising, and it also decreases the risk and potential of over-treating a patient.
Okay, let's move on to another topic, and this is, of course, there are so many effects of poverty on children later in life, and now there's research that shows it affects brain development.
Yes, and this is near and dear to me, because a lot of the work that I do is understanding what determines health. And that it's not just about what we eat and what we take in, but all these social factors, so where we live, work, play, and pray. And so how much income and poverty actually affects and impacts our health. And so this study actually shows a physical impact on a child based on poverty. And so the studies show that there are 2 parts of the brain in children who are in impoverished conditions, the hippocampus and the amygdala, which are both responsible for memory and emotion, were actually smaller in children who grew up in poverty than those who did not. One of the reasons why they feel this is, and it makes sense, the stressful environments in which children grow up. And they feel because of these stressful environments, parents may not have been as nurturing, as supportive, and not because they didn't want to particularly, but they have all these other stressors that are happening in their environments that they have to pay attention to. So it's a really phenomenal and I think enlightening study, especially in the field of social determinants of health.
And in this study, what is the definition of poverty? Where is it the traditional poverty line set by the Census Bureau?
Absolutely, that's the definition of poverty, and that's what they went by for this particular study. But I think there's a lot, and poverty can go by the number and the percentage below poverty level. But I think it's important to understand that it's not as concrete to talk about poverty by just a particular marker, that there are many factors that can influence stressful events in a family's house or in a communities as well.
If a family gets out of poverty at some point in the child's life, can it reverse those
So the studies,
effects?
that's one of the good things about the studies, that it did show that, and that you can, if you read more to the child, and I talked about this a little bit last week about, there's a new study out that kids who are in poverty have less words that they were exposed to than kids who are not in poverty, and how much that impacts their child and their brain development. And so studies are showing that if we can teach parents better nurturing skills and parenting skills and give that to their children, that they can potentially reverse these effects and the effects of what poverty has caused.
Okay, before I let you go ahead and ruin everybody's Halloween. Give us these Halloween safety tips.
Okay, so I have a whole list of
Don't have fun, don't eat candy, don't go out. No, I'm joking.
Apples,
Right.
Yeah, I know. So the CDC actually came out with a great list, Safe Halloween, so I'm just going to go through this list. So one of them, avoiding trick-or-treating alone, as far as being just safe in your community. Fasten reflective tape if you're going to be outside. It's dark. We know it's going to be dark. Make sure you hold a flashlight if you're in we're in the city, so it's pretty well lit. But many of us also are in communities that are more suburbia and they're darker. Make sure you have a flashlight. That's possible. Even, you want to scare people. We don't always want to scare people. Look both ways when you're crossing the street. Walk on your sidewalks. Enter homes only if it's a trusted adult. Clearly, if it's a child of a certain age, very important to have adult supervision. Even if you're not going to the door, making sure that you are still present and seeing this child enter or come to the door and come back to the door. And never walk near lit candles. Somebody like me, whose hair may catch on fire. Also, be concerned, examine all treats for choking and making sure that it is child and age appropriate as well. A lot of little kids are going to be around too, and just making sure that they don't get into the treats and put them in their mouth.
And making sure it hasn't been tampered with.
And making sure it hasn't been tampered with, it's very important. When I grew up, we had a lot of conversation. I grew up in the suburbs, and we always had some incident regarding tampering. You don't hear it as much anymore, but I think it's still very important to pay attention to. And just making sure the masks, I was reading a study, sometimes the masks that we find in the stores have a lot of germs on them. So very important to make sure that they're cleaned off. Ew, exactly.
All right. Dr. Aletha Maybank, as always, great information. Thank you so much.
You're very welcome.
See you next week.
All right, thanks.